Good afternoon. I'm really delighted today to have the opportunity to share with you a panel of specialty nurses, nurses who are in specialty roles, and specifically the role of the clinical nurse leader. I'm Dr. Laura Fenimore, and I'm one of the professors at the School of Nursing, and joining our panel is also Dr. Rose Hoffman, who's an associate professor and is the program director for the Clinical Nurse Leader program, in addition to being the program director for our online program and our Master's of Nursing at the School of Nursing. And so thank you all for joining us today. And as we begin, I'm going to ask each of our panelists to introduce themselves, and as they introduce themselves, to give a little background about the role that they currently have and how the CNL degree and certification helps them and in their current role. So thank you so much. And let's start with you, Zach. I see you at the top of my screen. Tell us a bit about what your current role is and how the CNL helped you in prepare as well as in your day-to-day work.
Sure. So my name is Zach Perpetua. I am a clinical education specialist at a local hospital here. And so the role of the clinical education specialist really does take more than just education. Really, I am working alongside with other leaders, nursing leadership, quality, infection prevention, all kinds of things that I collaborate with, a lot of interprofessional collaboration, nurses, patient care technicians, physicians, you name it. And so I really do think that my time in the CNL program has really helped prepare me for this role. So the clinical practicum experience I had here at Passivant really opened me up for the job that I was able to attain here, and doing that sort of project and the interprofessional communication, and really gave me a great practice for what I do every day, day to day now, and also really kind of helped instill everything that I did to reach certification and continuing up with my certification. And I think it's all really come full circle. And I think that the Pitt CNL program has really helped me prepare, has really helped me succeed in my, my current role.
Thanks, Zach. And Latasha, you have a somewhat similar role to Zach's. Tell us about how your role as a clinical nurse leader.
Yeah, absolutely. Thank you, Dr. Fenimore. My name is Latasha Kast. I currently work at UPMC Passivant as an advanced clinical education specialist, covering the critical care areas. I've been in this role here about 3 months now, but I previously worked in a position as a clinician or an assistant manager on a unit too. And with that, was able to really utilize my skills as a CNL in my current role here. And similar to Zach's role, through that really collaborative partnership with the interdisciplinary team, working with the unit leadership to onboard new nurses, as well as identify quality improvement opportunities on the unit, and then developing the staff nurses on the unit to really lead and partner in those programs as well, and fostering and mentoring that development with other disciplines such as quality as the physicians, with respiratory therapy too, and having that understanding of the data and now translating that into practice and really helping develop the staff with that opportunity as well.
Thanks very much. Great answer. And Krystal, tell us about your role and how the CNL prepared you for it.
Hi, my name is Krystal Woljtaszek. I am a clinician at Presby on a trauma floor. So I think the CNL program was great for this position because in my position, I do a little bit of patient care and a little bit of leadership. So about 50% of the time I'm taking care of patients, and in the program we take pharmacy and physical assessment and all of these advanced nursing classes. So it's really helped me to better and refine my skills as a bedside nurse. So I haven't lost any of those skills yet. I'm also able to teach them. So in the CNL role, we also go through a teaching practicum and learning how to lead those kind of situations. So I do a lot with our nurses and PCTs and their yearly competencies, a lot with orientation and helping with their onboarding and what those kind of things look like, making sure they're getting all of the skills that they need before they come off orientation. The other half of my position is more of a leadership administration part. So we also take, in the program, things that learn about finance and budget. So I help with all of those things. I can better understand those things and also kind of relay that stuff to the staff in a more understandable way for them.
Very good. Thank you. And Ashley, last but not least.
Sure. Hi. Thank you for having me. I'm Ashley Iannazzo. I'm the Director of Clinical Operations with the Center for Nursing Excellence at UPMC, which is our corporate nursing at UPMC. I wear many hats here. I have a large role in our system-wide education committee and a lot of our education plans. I work on a lot of nursing projects that roll out across all of our enterprises. I run a few training programs, specifically our nursing orientation and our PCT orientation in Allegheny County. The list could go on, and I'll echo what Latasha said. I think one of the biggest things I took from the CNL program was really gaining a greater understanding for quality improvement and the importance of tying data to your outcomes to show a business case for whatever you want to do, whether it be patient care or working on a staffing budget, really tying those outcomes to the data, putting together a good project using evidence-based practice. I'm the executive lead on a lot of our system councils, including our evidence-based practice. I work with Latasha on our professional practice council. So truly, all of our nursing councils, committees, structures really focused and rooted in that evidence-based practice. So getting a strong foundation to learn how to do that and be able to tie those outcomes with that data is pivotal in any nursing leadership role that you take with you.
It's so exciting to hear about the different roles that each of you have. Rose, I'm looking at you thinking you must be so very proud of each of them. I wondered if you had a question that you'd like to ask them.
No, I am very much so. They know I could probably talk about this program for eternity because I really feel that it's so needed in healthcare. It is the only master's program, and this is just not for Pitt, this is all nationwide, that has a unique skill set in quality, safety, education, and leadership. And if any of them they've all addressed this topic, whether it's in an education or a quality framework, they're all doing leadership and patient safety, which is so important. And as I mentioned, as each of them mentioned, their CNL includes such information as finance, budget, policy, and that huge interdisciplinary framework that is so needed for them. So that's about the only thing I want to say. I'm going to let them do a lot of the talking because, as I said, I could talk forever on this, but it's more important that they hear from graduates, not their faculty member.
Sure. Well, I want to do a quick round robin of the four of you. Why Pitt? Why did you pick this program? Let's start with you, Ashley.
I'm going to come back at you and say, why not Pitt? I fortunately did my undergraduate at Pitt as well, which was a really great transition for me into a graduate program, but truly the reputation at the University of Pittsburgh, the top ranked CNL program, along with many of the graduate programs. I was fortunate to continue on to my DNP with Pitt as well. So really, truly the reputation with Pitt is unmatched. And if I could do a program right up the road from my home, it was worth it to me. And it doesn't fit everybody's need in their life where they are, but I'm lucky to say Pitt was the perfect match and the only match for me.
So she covered a lot of ground, folks. What else would you add, Zach?
Well, I also got my bachelor's in nursing at, Pitt Johnstown, but still, was familiar with the Pitt system and, had an amazing experience with my bachelor's. And I have to say, number 3 in the nation, right in our backyards here in Pittsburgh, Pennsylvania. You really can't beat it. And, why Pitt? I'm currently working on my DMP now at Pitt. So, I think, I have hardly, actually really nothing at all negative to say about Pitt. It's been quite a wonderful experience. So I started with Pitt, continue with Pitt, and I'm going to finish off with Pitt. And,
Going for the trifecta.
Yep.
Very good for you. Hey, Krystal or Latasha, do you have anything else that you'd like to offer, maybe a different perspective?
I do have one more thing. So Pitt offers non-degree seeking. So when I graduated out of nursing school, I applied to Pitt's grad school as non-degree seeking and took one class every year up until the 12 credits that you could take. UPMC helped pay for it all. And I remember sitting with Rose in my interview and she was like, why now? And I said, well, I'm out of credits. So now I have to pick a program. And the CNL just fit perfectly for what I wanted to do. So that was a good stepping stone. 12 credits were already done before I even started the program. Good.
And Latasha?
I also agree with everything else that was said too. And one of the other things that I thought about when I considered this program here, I also went to Pitt for my BSN, so I continued on there. But the thing I really liked was having the flexibility of being an online student. So I could take classes both online and in person as well too. So depending on what the class was, the topic, some of the ones like patho and pharm, I was more interested in taking in person in that learning environment. Plus then I had the opportunity to take classes online too. Mm-hmm. And I think the other second factor that I really liked about the Pitt program was the clinical rotation and practicum experiences, and that Pitt helped find locations and different practice sites for that, for your practicum experience was very valuable in looking at that as a good benefit with the program.
Wonderful. So as you the 4 of you think about your experience in the CNL program, I wonder if there's one thing that really stood out to you as the thing that had made the most impression on you and has really helped to shape the nurse that you are today.
I can go ahead and speak up. I have to say that I really, truly did enjoy the clinical practicum experiences. Mm-hmm. And the clinical practicum experience that I had here at Passivant really, truly did open up the doors for the career that I have today. I was placed for my the final practicum, the CNL, what was it? I think it was just called CNL Practicum 1 and 2.
1 and 2.
Yeah. That I had here at Passivant, and through learning leadership, learning how the education department works here, doing a Microsystem project here at Passivant really got me to fall in love with this hospital. And then there just so happened to be an opening in the education department, and with the training I had, I was a good candidate for that position and was able to obtain that position. So I think that hands down was the best for me.
Excellent. We're going to come back to that idea of microsystem projects, but Krystal, was there one thing that stood out that made the most difference to you in your current role?
I think when I was placed at Shadyside for one of my practicums, and I was with a nurse practitioner who led so many interdisciplinary and led it so well, led so many teams. And I think that really helped me in my role because I do a lot with physicians and respiratory and education and all those kind of things. So I was able to bring all of her skills about how to lead and how to talk to people and how to persuade people with data and information like that about how to get things done the way you need them to be done.
Excellent. Ashley?
I have almost an identical story to Zach's, just in a different facility and business unit. But yes, use your clinical practicums as your networking opportunity and really get uncomfortable. I remember Dr. Hoffman recommended that I did a project outside of the unit that I worked on. I was a clinical nurse at McGee Women's Hospital at the time. And that was one of the hardest and most uncomfortable things for me to do, was work with a different leader on a unit that I didn't know anything about. But it really brought a lot of connections about, and same situation as Zach, my final semester, I was doing a practicum in the quality improvement office. And at the same time that I graduated, the risk manager had gone out on a medical leave. So they had asked me to temporarily fill in during her 12-week medical leave. She ended up not coming back. So I was able to interview and seamlessly transition into a quality coordinator position right after my graduation. So take advantage of those opportunities with your clinical practicums for sure.
Wonderful. And Latasha?
I think mine also is very similar to Zach, Krystal, and Ashley. Mine also was the practicum experiences with the clinical practicum 1 and 2. I actually had the opportunity to do mine in a completely different health system that I was not familiar with and had never walked into before. And the nice thing with that role is they actually, in that health system, use the CNL as a designated CNL as a clinical nurse leader on the unit. So it was great to see really the CNL role as it's designed to be, and really how that functions and how that fits in that department, plus how all the other departments and units throughout the hospital, how they adapt their CNL role to fit into that structure as well too. So it was definitely a great, rewarding experience.
Wonderful. And I know we only have Dr. Hoffman here for a few more minutes, and that 3 of you here on the call were involved in the preparation of a manuscript and an article that actually got published as an editorial in the Journal of Professional Nursing earlier this year. And the title of which was The CNL Leader and COVID-19, Leadership and Quality at the Point of Care. And so, Zach and Krystal, you were 2 of the co-authors on this paper, along with Dr. Hoffman. And so I wondered if you would talk just a minute or 2 about what that experience was like in terms of preparing information about the role of the clinical nurse leader in the context of the current pandemic. And I'll start with you, Krystal. What was that like for you?
It was really cool, actually. So our unit at Presby was the first unit that was non-ICU to accept COVID patients. And since Pittsburgh was kind of behind everybody, we had a little bit of time to prepare. So I was able to use basically every aspect from this degree to help get my nurses ready. We did a lot of education. We did interdisciplinary teamwork with respiratory and the senior physicians, the ICU nurses. We learned how to do team nursing. We came up with a way, which was my input on the paper. We did team nursing. So every 2 COVID patients had 2 nurses. So one COVID nurse went into the room, the other one stayed outside, was kind of like their runner, their backup, and really just a piece of support. This was really scary. We had no idea what we were doing. And these nurses just were more comfortable knowing there was somebody in the background there to help them. So I was able to just be like, their cheerleader, their helper, and also kind of like teach them and guide them along the way.
Very good. And Zach, what was your experience in contributing to this terrific article?
Yeah, so when it quickly became apparent that COVID was something that we were going to need to respond to and something that we was going to be a thing here in Pittsburgh, the education department, we all just kind of hunkered down. We really kind of halted our day-to-day responsibilities in education and really just, took everything that we needed. We went back to the policies to see what is donning and doffing and what do we need to do for these airborne precautions, and just really starting from the very beginning, putting that together. And these nurses, out on the floors, so scared and so worried about what's going to happen for me today? What am I going to experience today? So we took that education that we pulled together and we spread that throughout the hospital. Also, as Krystal mentioned, offering support to these nurses that they have they have worries, they're scared, they're concerned. So offering support to them, but using evidence-based practice and going back to those policies and finding out what we need to do. And things were changing rapidly from day to day. So we always were looking for the best evidence to guide the changes that we were doing. And it was a very exciting time. It really was. Just being able to help make such an impact. I was not involved with patient care, but I was able to help train those who were in patient care to kind of help the helpers. And that really meant a lot. And it was really an interesting time.
And I know, Dr. Hoffman, you are such a passionate advocate for this role, and certainly sharing that information in a publication that is widely read by nurses, not only in academia, but also in service is really important. I wonder, before you have to leave, do you have any questions that you'd like to ask our panelists?
Well, if you could, I guess, if you could recommend this program, can you tell me one thing that you really felt was an aha moment in this program that I could use for anybody who is interested in pursuing this area of concentration?
Great question. You probably need to think a minute or two about that one, huh?
I think for me, it really was when I finished the program, Rosa, I think that you were a really great mentor for the program, always a great cheerleader of, us pulling our ideas together and getting things going for us and just really making us think throughout the program. But it really wasn't until after I completed the program and I was studying for certification that I really realized, oh my God, I learned so much in the last few years. And then moving into the job that I have now, I truly do use those CNL principles on a day-to-day basis. But it really wasn't until I was studying for the exam that I was like, wow, I really received a really wonderful education. I really have truly learned so much in the last few years.
Oh, thank you.
I have two aha moments. The first one being that I get asked a lot from nurses who are thinking about going back to graduate school. Oh, should I get a master's in education? Should I get a master's in leadership? What about informatics? And I always tell them, go to a CNL program. I went to Pitt because you don't have to specialize in any of those tracks. And this program gives you such a well-rounded degree. You won't have to feel pigeonholed into some sort of specialty with your degree. So the CNL, it couldn't be more of a well-rounded graduate degree for a master's prepared nurse. You really can do whatever you want with your CNL. And then the second thing about the certification was, Zach, I tell people as well, hey, you can get a graduate degree and a certification if you take the CNL program, which we know magnet facilities are top-notch places for nurses to work. They're always looking for certifications, always trying to encourage nurses to become certified. And so you'll just have that tool in your toolbox when interviewing for other positions and really trying to advance your career. You'll certainly look really great on paper with that certification, and then make you a more well-rounded nurse as well.
I think mine was when my project was accepted for the CNL Summit in Texas last year. I did a project with Zach, was my preceptor. So I did a project on insulin pumps and diabetic patients at Passivant. And Rose was like, please submit it to this, please submit it to that. So I presented it at St. Margaret's, and then I submitted it to the summit. And I remember emailing her saying, I got accepted. Like, can we believe I got accepted? And I just was like, wow, I know what I'm doing. Like this, I've learned so much, and I can like put it all together. And then Latasha was there with me when we were in Texas, and it was such a great experience. Just like summed up the whole program for me.
Wonderful.
And I think my aha moment was really realizing after I graduated the program and was working in my previous role and was leading a project on that unit, really how much knowledge and skills that I learned from the program, and now was able to translate that into practice with looking at the data, looking at the outcomes, and really forming a multidisciplinary team and leading that team as well. and how those concepts and skills really kind of translate to real life practice, and kind of connecting all the pieces together too.
Excellent. So I wanted to circle back to this idea of a microsystem project. What is a microsystem project, and what did you do for your project? And maybe we can start with Krystal.
Before Krystal gets started, unfortunately, guys, I have another meeting. So I'm going to have to cut off with this one and go to my other one. But I want to thank you all very much. You're such great advocates and you're wonderful graduates. So trust me, I call upon my graduates very frequently. So you all are doing such wonderful work. I'm very proud of you. So stay in touch, and you know where I can be found. You know where I live, as I tell people. You know where I live. So
Thank
take
you for
care,
joining
everybody.
us, Rose.
Bye-bye.
Hi. Okay. So a microsystem is basically a unit within inside the hospital. So my microsystem, I was way out of my element, and I was placed at the McGee Women's Gyn-Onc Family Care Center.
Mm-hmm.
So the care center looked at family caregivers of women with gynecologic cancer and how we can take care of them and how we can better take care of them so that they can better take care of their family. They had no way of documenting. They had no standardized charting within the Epic outpatient charting system. So my project was to create a template and get it implemented into the outpatient charting system. I did a lot of work with IT. I had to talk to the legal department, things that I never, ever thought I would be doing as a nurse. Unfortunately, COVID happened during my last semester. So my project kind of hit a wall and never got through. But the nurses that were working there have that template, and it was already approved, and legal approved everything. So they're able to better use it and hopefully get it implemented here in the future.
Excellent. Good for you. And Zach, what was your project about?
So my microsystem, my preceptor was a unit director on a nursing unit here at Passavant, and through kind of learning, getting an idea for things that happened on the unit. It was a step down unit, and there were very high acuity patients there, trying to manage nurse satisfaction about their patient assignments, getting equitable assignments. So I looked up a lot of literature about acuity scales for measuring patient acuity to get equitable nursing assignments, and ended up trialing that acuity scale on a nursing unit. And then we actually then spread it to another unit and trialed it there as well. And we have had a lot of success with these acuity scales. And since then, I actually was invited to join a system committee on acuity scales in getting an acuity system out to UPMC. After our CNO saw my presentation at our professional practice council meeting, I was able to work with the system in getting system tools together for acuity.
Excellent. Wonderful. And Latasha, what was your project about?
For my project, I was at a local academic hospital that has a large, robust perioperative area. So I was in the perioperative department there. And really one of the things that we focused on and noticed that there were delays in on-time starts for first cases for the operating room. And this ultimately caused a trickle-down effect for patient cases later in the day, because every minute of OR delay costs between $37 and $41 per minute. And we were noticing that we had delays between 1 minute to 30 minutes, which then causes a substantial financial revenue loss for the hospital, because the OR is such a large source of revenue for the facility. So we worked with the interdisciplinary team in really identifying that it really was such a wide focus. It was not only nursing, it included our anesthesiologists, our CRNAs in the anesthesia team, our physicians, the OR staff, patient transport, patient arrival, and all of these different processes here. And really we were able to work with developing a team within our team that really were able to utilize the staff nurses to really develop their role in participating in an interdisciplinary project. And we're able to, through several different process improvement measures, such as improving the on-time starts with the inpatient process and developing a checklist that was more simplified for the inpatient nurses, we were actually able to reduce our financial loss from the hospital by almost $17,000 per month. So really that was a financial gain to the hospital of $17,000 a month.
Excellent. And lastly, Ashley.
Sure. My Microsystem project was on a medical unit, and my focus was reducing noise at night. Noise at night was one of their largest opportunities on their patient satisfaction surveys. So that was my focus. It feels like so long ago now that I'm talking about this. We had it was called the tuck-in team. And it was basically ensuring that your patient had everything that they needed before bed. It was a combination of like an hourly round, and making sure, they had a new IV bag, their SCD machine was plugged in, their cardiac monitor was turned down to an appropriate level, still to maintain safety. And we did make improvements in reducing noise from patient surveys that they completed. So that was, it was fun.
And I'm so glad you said that, because as each of you were talking, I thought, it sounds like you had fun. I'm sure at the time it didn't necessarily feel like that much fun, but when you look back on what you've achieved, you are wonderful representatives of the University of Pittsburgh School of Nursing. And I cannot thank you enough for sharing your passion for this role, for describing the diversity of what is possible as a clinical nurse leader. And I know that our first year students who are going to get a chance to see this will probably want to reach out to you. So you may be getting some future emails from me with questions from them. And I really know that you will follow through and give us your additional insight. Thank you so much. I wish you the very best of luck as you continue, some of you, your graduate studies. Zach and Ashley have already, or Zach is in the program. Ashley's completed the Health Systems Executive Leadership program, and I look forward someday to seeing Latasha and Krystal in that program as well, as you continue your development as a professional nurse. So thank you again, and look forward to seeing many of you in the future.
Thanks.
Thank you.
All right.